Welcome to Stirring Strength, Perspectives on Mental Health and Addiction. And on today, we are graced with the presence of Susan Stevenson, Ward 4 Councillor. Hi, Susan.
Pleasure to be here.
I'm glad you're here. I've had the pleasure of watching your journey on social media. So controversial, so ups and downs, so many polarized opinions on what's going on in the core and the substance use and the homeless population. And I thought, I need to have you on the show and let's talk about what's going on. So I'm going to just pass the mic over to you and I'm going to sit back and I'm going to listen to what it is that you're recognizing in the platform that you're trying to what you're trying to communicate to the city.
Yeah, well, what we're doing doesn't seem to be working. And it's like no blame, shame, or guilt. Can we just look and evaluate? I'm sure there's many great things that are happening, and there's some things that clearly are not working. And can we just say, thanks for whatever that was, and we're going to stop doing what isn't working, and then find out where are the gaps, and how can we fill those? Because lives literally are at stake.
Yeah. So specifically, what's not working? Because we're talking about a whole bunch of moving parts, right? So what are the things that are...
Unfortunately, there's a lot of things that aren't working, right? Our homeless numbers are climbing. The level of addiction is increasing. The people are getting younger. There's fewer and fewer spaces where people can either live or even move about without seeing open drug use. And so we don't have, as far as I know, a sober shelter. We don't have public housing that is drug-free. I think it's a real tragedy. And I've heard you mention before, too, the gaps that people who take that brave step to go into withdrawal management don't have a place for them to help them walk out that journey. I mean, it's tough enough anyway, and they might slip off and need to come back, but that we don't have a path for them to hold them in a place of hope and possibility and safety as long as they're willing to walk out that journey. So the province last year said that they were going to go the Alberta model route. It actually happened while I was out in Calgary at the Recovery Capital Conference.
Right.
And that is about recovery-oriented communities. And that's what I'd like to see for London, is that we embrace and support recovery of all kinds, honestly, because people are walking out all kinds of journeys in terms of healthier, happier lives. And to create those spaces, I think, is paramount. Recovery of any kind is a long journey. It's not 10 days or 5 days or whatever it is.
Yeah. I want to be cautious to not, I'm not here to, point fingers. I mean, I certainly don't want to do that. And I love your approach right out of the gate saying something's not working and let's just, humbly move on, right?
Yeah.
However, those hot topics are some of those things that aren't working. And I'm curious, what is it that you see contribute to? You tell me about, there's a rise on all of these things. What are we seeing are causing those? What do you think are contributing to these big rises in these numbers?
Well, I think there's lots of reasons, sadly, but I guess as a city councillor, I'm looking at what as a municipality, what as a council could we do to help, right? Because people are facing a lot of challenges and stresses in life that might contribute to that. But what are we doing as a council? And what, they talk about the 4 pillars of dealing with addiction, right? But we seem to really focus on the harm reduction piece. And anything else seems to cause a lot of consternation in some groups. And I feel quite attacked at times when we just bring it up. Like, what about these other things? No one, I don't think no one, but I'm not saying no harm reduction. I'm just saying, how about, what are we doing in terms of prevention? What are we doing in terms of treatment? What are we doing in terms of these other things that will support people? And the polarization and the inability to debate and talk about things and show the public what is happening, the transparency is hurting us, I think.
Right. Inability to debate.
It's a lost art, I think.
Yeah, it turns into personal and shaming and hurtful and difficult and an emotional thing instead of saying, hey, let's look at the issues. And
yeah, one of my biggest goals is just to create that space. for people, right? I love the expression iron sharpens iron. I'd love to be debated and challenged. It makes me better. It makes sure that I've got good solutions that I'm bringing forward. But iron doesn't sharpen iron if we're stabbing each other.
Yeah, no, I like that analogy. There's a truth to it. So from the city council perspective, we see that where there's a lot of influx of funding into, and sorry if I'm going off track, but you had mentioned the 4 pillars, which I believe is policing, harm reduction, treatment, and prevention, right? However, we're putting a lot into a couple of them, but not maybe the others.
Yeah.
Right?
Yeah.
So from that, what is it that you're thinking that the city needs to do? How do we change that?
Well, I think we've got scarce resources, in terms of taxpayer dollars. So we need to ensure that we're creating outcomes with those. And, people call them Band-Aid solutions, and sometimes that's not a pleasant term. But really, what are we creating? At council today, we've got $3.2 million in funding over the next year that is going to help people live unsheltered. So at the end of the year, in that $3 million, what have we actually done? The problem, we haven't even moved a few people into indoor 24/7 spaces.
Right.
So I think that's a miss. I think we can do better. And what we hear is, well, this is the best we can do. And I think it takes real leadership to say that's not good enough. And I believe we can do better, and let's set what better looks like and make it happen rather than just accept what, quite frankly, is unacceptable.
Yeah, I think everyone's kind of afraid to rock the apple cart, so to speak.
It's rocking.
This is status.
It's denial to say that it's not rocking right now.
Correct.
Things are not okay.
What I recognize is nobody wants to be the person making noise about it because they don't want to rock their own apple cart. So it's very like, hey, let's just not, and you kind of said it, it's kind of hot topic, right? And there's individuals that say, if I go, rock this boat, it means that I'm not going to maybe have a job tomorrow, or I'm not going to, get reelected, or whatever that may mean.
That is a very real concern. People look at me and don't want what's happened to me, right? I've had headlines that call me unhinged, dangerous, complaints made against me for what? For asking questions, for asking for accountability, for wanting a shelter that opens to have beds for people. So I don't know what's happened in the past that's made accountability so scary and dangerous, but I'd like to change that. I'd like to just stay in that space of it's okay to make mistakes. It's okay to try programs that don't work, but if we don't own what's not working, we can't fix it.
Right, right. What makes it so difficult, and I'm not a politician by any means, nor am I politically driven, but I see it and I observe it from a distance, and right? Much like a safe distance from a campfire, and I'm going to watch it from over here. But what are the actual difficulties in making these changes? Like, there's obviously, it's not just as simple as waving a magic wand. There's leaps and bounds and things that need to happen first. And what do those look like? What seems to be the barriers to making these bigger changes?
Well, it sounds funny, but I'm sure the changes are not simple. I wish there was a simple wand, but we can't even talk about it. So we had the hunger strike in the summer of August 2022 while we were campaigning. And when we came in, there was this whole of community response that was set up. And they were having summits, 3 summits, where everybody was meeting, the police, the hospitals, the social services. It sounded really great, but the politicians were all asked not to come. And there were no neighborhood community groups. So we were missing the voice of the people, the voice of, the everyday Londoners. We're not at the table. And so I think that caused a lot of problems. We had what appears like an activist agenda now coming through these official challenges, or these official channels, I can't speak, channels, without debate or discussion. And when questions were asked, that was seen as problematic. So, truthfully, I would have loved to have been wrong about that and had been creating great results in the city, and I could say I was wrong. But unfortunately, we're worse off and predicted to be getting worse, and we're still not saying maybe we should reflect, maybe we should discuss and maybe change course.
Right. Ultimately, there's no one silver bullet. There's no one person responsible. There's no, this person decided to put this program in place. It was, a collective of signed documents, and this happens and that happens, and then it turns into that place. So if we wanted to point that energy somewhere, where are we pointing it?
Well, I think ultimately it comes down to council, right? Okay. But there has to be the will of council to take on the responsibility and the accountability of such a challenging crisis, right? It's not for the faint of heart.
No. I spoke with somebody earlier, and they were talking about the kind of the misdirection of it, to say, when we come in and we want to talk about prevention, it immediately goes to, but we have a problem here. We have to do this problem first. So let's never mind prevention. We got to deal with this fire that's happening here. But then that fire never goes out because we never look back at the prevention piece. So something needs to change in that way. How do you think we shift the perspective, of the city to start looking at the need for prevention?
Well, I think it's in the discussion and the awareness. Most people know something is wrong, but they don't know what it is.
Yeah.
And so to have that discussion, it's why I'm here. It's why I choose to be in the media and post things on social media, because people really care. And they are traumatized, quite frankly, whether they're living on the streets or they know somebody who's trapped in addiction. Almost everybody you talk to has some connection to it.
Right.
And they want to help, but they don't know what to do. They don't know what is the sort of quote right thing. Chances are there's many right things that we can do, because different people need different supports.
Right.
But we get to talk about it.
Right.
And so I think that's the number one thing. We're better together. We're better when we challenge each other and bring forward solutions and not make each other wrong. And I think talking about it is the first step to the solution.
I see that it's very polar. So it goes to one extreme to the next, where there's two different problems. There's the problem of, what the homeless population and addiction are doing to the community. And then there's the humanity problem of saying, what are we doing for the people? And they seem to be two different groups of people that are kind of pitted against each other. So we want to help the community and we want to help the taxpayer. We want to help that. But then we also go, well, but it seems to be that there's, and not in an absolute way, but there seems to be different camps. When I watch and I read the comments that happen, there's this is disgusting, this is blah, blah, blah. And then there's others saying, my place. And then the other people saying, look at, these are human beings. And it seems to be one direction or the other. Any thoughts on how we?
I do. That definitely is the way it seems. I think it's a false dichotomy, though. Because if we're truly helping people, it doesn't hurt other people. Sure. If we're truly helping the people who are addicted and homeless, it doesn't devastate a neighborhood.
Right.
Right? So, and I think we lump the two together, or people, I try not to, but they lump the two together. Homelessness and addiction are very, very different. And somebody who is impoverished and needs to just curl up in the alcove of a business has never been a public safety concern.
Right. Yeah, it's a different thing, and I get, you're right. I think it's more of a it's a perceived idea, but at the same time, it's very real to those people arguing it. It's very real to the individuals who are saying, well, we need to change this or we need to change that, and it feels as though it's a human issue that's turning into, who's right and who's wrong, opposed to how do we help a human? And I'm with you. If we help them, we help all of them. Yeah. Right. My concern is I know we can keep having the conversations, but is there any other ways for us to start making it so that other people can see the other side? Because they don't. They're very, very.
Well, and there are going to be some on either side who will never see it, right? But in that middle ground, we get to be honest about, is our help helping?
Yeah.
Because I think it's faux compassion. I think it's being nice and not being kind. Is it really the best we can do is to bring somebody in for a few minutes and give them a sandwich and a clean pair of socks? Is that really helping people who are living in a traumatic situation 24/7, some of them for years? Is that help?
It's, I'm I'm going to go to break because I could talk about this all day. So we're going to go to a quick break and we're going to come back and talk about, whether sandwiches help or not. And I'm fascinated by it. We'll be right back with Councilperson Susan Stevenson on Stirring Strength. Welcome back to Stirring Strength, where we're talking about the value of a sandwich. So, is it helping? And I think you're right. I think there's parts of it where we go, a sandwich can mean the difference to one individual in that moment in time, and being able to connect with them and say, here, I'm here, being compassionate and human, to just show them that there's more to it than the aggressive, dangerous world that they see. So absolutely helpful, but at the same time, in the bigger picture of things, there's other things that also need to be done to create a conduit to care and to well-being.
I guess I'll clarify.
Yeah.
The value of a taxpayer-funded sandwich.
Okay.
Because there are many generous groups and people and organizations in our city that provide the much-needed food supports and other things that not just our unhoused, but some of our low-income people need as well.
Yeah.
But the value of a taxpayer-funded sandwich versus what those taxpayer dollars could provide in terms of real, actual, long-standing help.
Sure. So putting those tax dollars into, like we said, some of those other pillars and some of the prevention and other ways wouldn't be the end of the world.
Well, the one thing everybody seems to agree on is safe 24/7 shelter spaces.
Okay. Tell me more about that.
Well, there's currently, we don't have enough places for people to go, right? So even Arcade, it's a lottery every morning at 11 a.m. to see who gets one of the 30 mattresses on the floor. Still good to come inside, but imagine the instability of that and dealing with that every single day.
Right.
So ideally, there's spaces where people can go, where they have a bed, where they know they're going to have a bed, and they can be there all day if they want, and where it's safe. And what about away from drugs, to honor those who are walking out recovery or have that desire?
Yeah. There's certainly, and my experience in the shelter system is the shelter system in itself also is, there's dealers right in the place. There's people, there's drug use happening, no matter how hard they try, and the beautiful people that do the work, and nothing against them, but there's also a part that says, there's substance use happening within the place. So people trying to make those changes in an environment that is hostile is difficult. And you said something about safe. And I know some of the people that I've met and talked to on the street will tell you that they feel safer sleeping in an alley than they do within the shelter system because of that shared room space and whatever that means. So how do we solve that problem? How do we, get it so that they're safer?
That's a conversation I'd love to have.
Okay.
Because if it's not safe, it defies the whole word of shelter, right? The whole meaning of that word. And we knew about this. We heard about it when we were campaigning in 2022. It's part of our strategic plan, but we're not talking about it.
Yeah.
How do we make our shelter spaces safe? How do we make our public housing safer for people?
Right.
And that's fundamental to reducing the number of people who are living unsheltered, I think. And we don't talk enough about the crisis of addiction, right? The languaging, there's a lot of play on languaging in terms of the toxicity of the drugs, but we have a crisis of addiction. And what are we doing about that? And what is it costing us in terms of public safety, in terms of being able to offer services? Because if we were able to offer safe shelter somehow, it would in all likelihood be a lot cheaper and a lot easier to staff than what we're currently doing. Because it's taking a real wear and tear, not only on the people who are staying in the shelters, but in the employees and in the neighboring community. So we got this situation where we're spending a lot of money and no one is better off. Like you could say inside versus outside, maybe it's better, but why isn't it a safe haven?
Right.
Why isn't it a pathway to healthy living and housing? And what can we do as a municipality to get that?
Right.
Rather than just say this is the best we can do, and now because people don't feel safe in shelters, we're going to help them live outdoors. It feels like we're sliding downhill.
Yeah, we need 5-hour-long show to even get to scratch the surface of this. One of the things that stood out to me in the past was the recognition that as we create shelter beds, as we create services, as we create harm reduction, safe supply, all these things, one of the things that I've noted in talking to fellow professionals and in my own professional purview is we're getting a lot of people that are actually being sent to London to come and participate in those services because we have more services than others. So there's also a point where we could turn every empty building into a shelter, and then we just have people coming from all over the world to come and live at London, Ontario, because there's all these beds. And I'm not saying that that's the case, but there's an over adjustment, there's an overdoing of the process, and that's a very difficult conversation nobody wants to have, because we also say just more beds and that's the answer, and if we have those beds then people will be okay. So but there's also a where does it end?
Yeah, it's complicated, right? Yeah. Do we need a lot of money to solve this? Absolutely. Of course. But is it more money doing what we're doing now? I don't think so. No. We need more beds. More beds of what we're doing now? Right. Apparently not. Yeah. Right? So it's the details matter. Sure. And so I think it's a worthy conversation.
So more, and I'll use my own words, more a compassionate, integrated housing that would be more geared to the individual opposed to what we're doing now?
Well, I think that's a long conversation, that one, but we definitely get to do something different than what we're doing. We've said our shelter isn't safe. Instead of dealing with that, we're now taking care of people in the parks. Parks are not safe. So how do we actually solve the root of the problem? And when we talk about people coming to London, yes, they are. And they're coming. And are they going to come more if council goes ahead and invests another $3.2 million in bringing supports and services to people living unsheltered? We might get even more. If we were going to be a regional center for addiction treatment and recovery, I would happily be a regional center and welcome people from all around to walk out a life of recovery here. But if we're bringing people here to help sustain them on a spiral that is physical and mental decay, I'm not supportive of that.
Right. So hot topic, what role does Safe Supply play in this? I know that there's a lot of Safe Supplies in the East End, and I know a lot of your focus has been on the east of Adelaide strip there on Arcade, and I know that there's a lot of that Safe Supply happening in there. What role does this play in the future of the city?
Yeah, well, I think in talking to people who live in that area, they've blamed Safe Supply for a lot of the problems in Old East Village. And it's expanded. In the last couple of years, it's gone from 1 location to 4 locations. Now it's gone from Safe Supply to prescribed alternatives. It's happening all over. I think you've seen even in BC, which was a big proponent of Safe Supply, they've gone to witness dosing now. Yeah. So when I went to the Recovery Capital conference, they talked about Safe Supply, and they said that they do believe it's something that's part of a treatment program, but in very rare circumstances. And when people have exhausted all other paths, you can go to this, but it would be in an intense treatment program, never given out on and been walking out onto the street. So I leave that to the experts to use at their discretion in a way that doesn't put the public safety at risk. So I think witness dosing seems to be the way that it's going in BC. I'd like to see that here.
Right. So for the viewers at home, the Safe Supply is hydromorph are being prescribed by doctors, and they're going into the pharmacy and they'll be giving, a certain amount of dosage of pills, and they're able to take those and then go off into the street and go on with their day.
Yeah, and many of them are selling them for other drugs, which is then creating more drug addicts, is the fear and concern, right?
Yeah, and an influx in the behavior that is then associated to that as well, and an influx in the homelessness and all of those other things.
And it brings up a criminal element too. Then people are stealing and robbing from people, and it is a lucrative supply. If people are buying it here, they can sell it for more up north.
Oh yeah, so we can take it and move it out into other areas.
But then you're bringing organized crime in potentially.
So many trickle effects of this process. From your perspective as a counselor, what was the mentality to bring this in? Why would we where you say it's for a specific thing. I get that, but why would the city okay this?
Well, I don't know that the city okayed it. It was a federal government program.
Okay.
It originated in London, and my understanding was the original intent was to help street-level addicted sex workers to not need to sell their bodies to meet their drug habit. So it was a way of bringing women inside, eliminating the have to around that, and then being able to deal with it. I think the problems happened, my understanding of it, is when they expanded that to anybody, and I won't say anybody and everybody, but that's sort of what the public in that area feels.
Right.
And then it became a currency that people are using to support their drug habits, and it's having devastating consequences, is what we're hearing from many families and from even the police.
Right. So a federally started program, are you aware if the municipality has any say over its expansion, or because you would think that in your own backyard to be able to be like, hey guys, can we cut this out? Like one was enough for no, let's cut this off at the knees. Where is the city's role in allowing this to expand?
Yeah, it's something like I'd like to explore. Even coming before council today is some SUOP funding called Emergency Treatment Fund, and it's about bringing harm reduction to our city parks, the encampments in our parks. And part of it is referral to service. And I am concerned that the referral is going to be to safer supply. I do know that some people are having safer supply delivered to the encampments by the pharmacy. So it's a concern because I do not want to see that expanded here. But I also don't know as a municipality what right we have to say to doctors how they support their patients. Right? So if there is a way that the municipality could say it, I would like to, but I'm not sure as it drops into prescribed alternatives what say we have, but I will be looking into it.
So it's not like there's a freestanding building like a restaurant that is doing just safe supply, and they can come along and the city can say no, we're not going to permit this. It's more of a medical building, and what they're doing in that medical building is. It used to be.
As far as I know, it was isolated at London Intercommunity Health Centre. It was a federally run program with wraparound supports.
Right.
It was a 5-year program that ended yesterday. But since then, we've got, what I understand is doctors prescribing virtually from BC, and then pharmacies here handing it out. It's a daily dose of sometimes 20 to 30 pills that are then hitting our streets.
Yeah.
So when you look at what that's, what the implications are of that, and are there any caps on that? We had 1 pharmacy, now we have 4. Do we have more? Is it going to expand? Is it something we can advocate to the province to say, like in Alberta, we don't want this here?
Yeah.
Or we only want witness dosing? I think that's a reasonable ask, and I think given that the severe negative impacts on our city, I think it's worth us exploring what say we can and do have in terms of that kind of influx in our city.
Thank you, Susan, for being on the show today. Like I said, I could keep going and going and going. So we've created more questions and answers, but thank you for being on the show. Thank you for watching Stirring Strength, and we'll be back next time to talk more about the perspectives on mental health and addiction.